Ever wondered how pharmaceuticals are stored safely in warehouses? Welcome, as we delve into the fascinating world of temperature mapping, a critical process that ensures the integrity of pharmaceuticals and other sensitive products stored in warehouses. First off, it's crucial to understand the guidelines provided by the World Health Organization and the International Society for Pharmaceutical Engineering. These guidelines provide a framework for the proper storage and distribution of pharmaceuticals, with temperature control being a key factor. The first step in the temperature mapping process is a thorough pre-assessment of the warehouse. This involves identifying critical areas, potential temperature zones, and unique storage requirements based on the products housed in the facility. It's also important to note existing HVAC systems, insulation, and any potential sources of temperature fluctuations. Once the pre-assessment is complete, a comprehensive temperature mapping plan is developed. This plan should cover all areas within the warehouse, including the number and placement of temperature sensors, monitoring frequency, and the duration of the mapping study. It's vital that the plan aligns with the guidelines provided by the WHO and ISPE. Next comes the selection of appropriate data loggers and sensors for temperature mapping. These devices must meet the accuracy and calibration requirements outlined in the guidelines. The sensors are then strategically placed in areas most susceptible to temperature variations, such as corners, near doors, and in different storage zones. Now, the actual temperature mapping process begins. Implementing the plan systematically, data is collected at various times and under different conditions. This can include different seasons, times of the day, and during peak activity in the warehouse. All relevant environmental parameters are recorded during the mapping process. After completing the temperature mapping study, the collected data is analyzed. Results are compared against the specified temperature ranges in the guidelines. Any areas within the warehouse that fall outside the acceptable temperature limits are identified. This analysis helps in making informed decisions regarding necessary corrective actions. If discrepancies are found, corrective actions are taken to address temperature variations. These actions may involve adjusting HVAC settings, improving insulation, or reorganizing storage arrangements. It's crucial to document all corrective actions taken and ensure that they bring the warehouse back into compliance with the established guidelines. Remember, temperature mapping is not a one-time activity. Warehouses need to be periodically reassessed to ensure ongoing compliance with temperature guidelines. This may be necessary due to changes in product storage, equipment upgrades, or alterations to the warehouse infrastructure. In conclusion, proper temperature mapping of warehouses is vital for maintaining the quality and efficacy of stored pharmaceuticals. By following the guidelines set forth by WHO and ISPE, warehouses can create a robust temperature control system that safeguards the integrity of sensitive products. Thank you for joining us on this journey into the world of temperature mapping.